stupid. It's stupid.
I don't understand that either.
Not putting on the mask is just, listen, it's a mask, man. Like, ain't nobody telling you to give nothing up.
Right.
You just putting on the mask.
Going against their rights. I heard that.
Yeah, I had a friend that said something. It said certain people have always had to follow rules. So when they said put a mask on,
Right. Okay.
a mask got put on.
Is
Other cultures have not had to always follow rules.
Is that a mental health issue? I'm just asking. Is that...
What do you end up ordering? Health food.
Oh, we got some nuggets, fried. We can eat fried food every now and then.
Yeah, it's okay. Everything in moderation. Everything in moderation. My favorite saying is the wall of China wasn't built in a day. Okay.
You just gotta get there some type of way.
Yeah. Okay.
So what type of advice y'all get from?
Man, listen. Anytime I go to the doctor and my doctor tell me something, I call her, be like, hey, what this mean? Cause like the other day, I went for my 6-month checkup, and they sent something back about vitamin D, and vitamin D was low, so it's real low. Now my cholesterol was high last time I went. She was like, it's a little high this time, but they sent it to me in a form that I don't know what these words is, these big words, and I don't know what this is. So I snapshot, I tell Hope, send it to the angels, tell me what I need to do. And so, but it's still like, they're like, how do you increase your vitamin D, and how do you even get your vitamin D low?
It's funny you say that, because 2 years ago, we wouldn't go to the doctor for anything.
We both went down one of them.
If we went to the doctor, it was bad. I don't know why, I guess. You know, if you don't want to hear good news, just don't go. You just push through it.
Yeah.
But what ended up happening, the older that you get, you start looking around.
And folks
and
start leaving.
your age.
Yeah.
You know, and so you start looking at what's happening. Almost to the point of you paranoid.
Yeah, you scared about
You
everything.
go start checking it out. Then we moved into COVID.
Right.
And every sniffle, every cough, everybody got
I done got checked 3 times.
Twice for me, because it's just that field of unknown. Everybody trying to figure out exactly what's going on with it, and I think we still don't know.
No.
How do you get your vitamin D and all your vitamins low? And is it cultural thing, or is it hereditary about stuff?
So like for us, vitamin D, you could consider it cultural, because our pretty melanin, our nice melanin, blocks the sun. And so that's one way you get vitamin D. So we can't get it that way. And then a lot of African Americans.
Keep rolling.
A lot of African Americans are lactose intolerant.
So we don't drink milk.
So we don't drink
milk. I sure don't drink a bunch of milk.
Products, and that's another way we get vitamin D.
Yeah.
Mm-hmm. So that's why. So I mean, out of the 4 of us in this room, 2 of us more than likely gonna be vitamin D deficient.
They said mine was real low.
All right, so what does that mean, being vitamin D deficient?
So that just means your vitamin D is too low, and you may have symptoms like you may feel fatigue, you might have muscle aches, you might notice that your bones just hurt. And so once you do take the vitamin D, you'll notice like the leg aches and feeling tired. It should improve.
So I should go get that stuff that she prescribed for me.
Did she give you like a really high dose, like 50,000 units once a week or something?
She was telling me, once a week. I ain't taking that. I should.
Yes, you should take. You may have been feeling fine, but you're gonna feel even better.
What's too low? Like what was low? If you know
What's
too low?
Anything below 30.
Below 30.
Below 30, but I've seen it as low as like 9.
Oh yeah.
9, 10. So, and I mean, I suffer with vitamin D deficiency.
What happens you don't get that up? Like, what's the worst case scenario with vitamin D?
The older we get, our bones are not as strong, so you're more likely to have broken bones and fractures. So you should definitely get it up.
So is it a way to naturally, because he's on medication now.
I ain't on no medication. What you talking about?
Well, it's a supplement. It's a supplement.
Listen, vitamin and medication is two different things. I ain't on no medication.
Did it come out of the bottle?
I don't know. I ain't really got it, so I don't know when it come out of.
Yes, it's gonna come out of the bottle.
He got the salt pack.
It's a supplement. I mean, you being outside, and that's another thing I've seen a lot with COVID is because we've been having to be inside.
Right.
We're not going outside getting that sunlight, because sunlight is one of the best ways to get vitamin D. So unless you want to go sunbathe, even then it's still for us. Like I said, we have this melanin.
Right.
We're not gonna get enough.
So like with that COVID thing and the outside, like what is the right thing to be doing right now? Because some places open back up, some places close down. So
first of all, is it real?
It is very real. It is very real. It is a contagious disease. It's a viral illness similar to something like the flu, but it's very real, very much so. And there really isn't a right or wrong answer for your question, because it's going to depend on the environment. It's going to depend on who's in that environment, if they're following the recommendations, because I can say open up a restaurant and that restaurant follows all the guidelines, keeps all the chairs 6 feet apart, requires a mask. They're fine. I may have somewhere else that opens up that's huge, but they let all these people come in, be closer than 6 feet, no mask.
So I think that's part of what we're doing in our professional lives. When you look at the rules, the procedures that was put in place for COVID, the problem is, depending on your household, everybody's doing the same thing or different things. When you get one workplace or one restaurant, there's different things that each one of them is doing. When you get different states, so there's not a national strategy on
how to beat it.
Collectively, this is what we need to do.
Right. We should have just shut down. Everybody stay in the house. No, I was saying that. I'm still like that now. I was saying that back then. Stay in the house. Here's the thing. You already done gave these small businesses money. So obviously you done gave them a check so they won't go out of business. Now if you didn't get a check, you didn't get a check. Sorry, but we're talking about lives. So you issue the check, right? So the small businesses can stay in business. Well, if you to close down, they had money to last them over them 2-3 weeks or however long we need to stay in the house, and then it probably would have been 10 times better. Right now, I'm still saying right now, it's going to be one time.
We need to do just a cold stop of everything.
Stop. Shut down.
You saying that too?
I agree. And if you look back, like they had some articles with China, it started there, where, for several months at the beginning of the year, they shut down. Like if you were not going to work or somewhere essential, you could not be out. The number of cases dropped drastically. And it's because nobody was going out, so it wasn't in the air. We were all quarantined together, but I agree. I totally agree. And my fear is that with winter, we probably are going to have to do that, because you're going to be not only fighting COVID, but we're walking into flu season.
Colds.
And you're not gonna
Everybody finna be scared.
Yeah, and you're not going to know what's what, because flu and COVID symptoms look very similar.
Right.
So like if you get, I don't even know how to ask this question. If
You just ask.
If you get sick, how do you determine if you should go? Yeah, if you should go get tested. This might be cold. How do you know?
So one of the first things I always ask: have you been around anybody that you know had COVID?
Right.
If you know for certain, hey, I was around Billy Bob and he tested positive,
right,
and you had any type of symptoms like fever, cough, shortness of breath, nausea, diarrhea, stuff tasting funny, or not even being able to taste at all, you should get tested.
Right.
Mm-hmm.
Right. Okay.
And that's the thing. I like using the CDC for what I follow. I follow the CDC. Just day before yesterday, they put out some new guidelines, because initially, a few weeks ago, I think they had put out, well, if you come into contact with someone, but you're not having symptoms, don't get tested, which I didn't agree with that. Yeah, I did not agree with that. But they have they have since rescinded that, and now they're saying, hey, if you have symptoms, you need to go get tested. And you've been around somebody, you need to go get tested.
Right. But for shutting down, like y'all said we should have, I agree with that also. But I think it's difficult because Congress can't let you shut down. That governors have to do that, right? You can't just shut down the state. I thought governors have to shut down their own individual state, right?
I know the president can't be the one. Like
Right, he can't do it. Like, that's what I'm saying. So,
yeah.
so with that being, I think it's harder to make it a national shutdown when you got these governing individual places. They're going by different rules, and their cases are lower, so they feel like, okay, well, we don't need to shut down.
Right,
but then you got these same people that's traveling to these places.
They got it.
That got it,
Right.
and you're still doing the same thing.
But
Well, some states have put in mandates. If, for example, if you travel to New York and you've been in Alabama,
Right.
you have to quarantine
Yeah.
for 2 weeks
Right.
before you can
Right.
before you can be sent
There needs
out.
to be more like that
But
in order
that's
to.
my thing. My thing though, if you catch some new disease, right?
Right.
And you find a way to beat it, and it's out here, I'm going to derail and be like, hey man, how
How do you
do
be-
this?
yeah,
You know
yeah.
what I'm saying? If China, if it started in China,
Right.
and China shut down,
Right. Instead of making fun of where it comes
Yeah,
from,
I'm
and
just
I
saying
would try to
that
find
they-
out how to help my people.
yeah,
That
they follow suit.
Right.
I mean, that's just how I would talk.
Yeah,
that makes sense.
it makes sense.
That makes sense.
Total sense.
So how is it in the? Cause you do VA, but you done been on both sides of it. Which one you like to?
Ooh,
Not throwing shots at nobody.
but I have to be careful what I say.
Cause he,
Don't do it. Don't tell her. Don't tell her.
So, I like working for the government. I do, and I like it because I like structure.
okay.
So working in the private sector, while there is structure, it's not the same type of structure like government structure.
Right.
So I like that part of it. And my dad is a veteran, so
Okay.
I got
So,
a kind
yeah,
of special
yeah.
place right there for them.
Cool.
So I really like
So it's a
it.
bonus.
Yeah.
So are you satisfied with the care that he receives at the VA versus?
Yes. He actually did not start receiving care there until I started working. I was like, you really should consider coming to the VA. I mean, they do a lot of stuff for the veterans. They take good care of them. And he started coming, and now he does all his care there.
Yeah. One thing that we noticed that it was a shortage as far as professionals that were going into the mental health. And from the VA standpoint, a lot of your veterans are coming in, and over the years we're learning as we go into our 20th year of combat, and so mental health is on the forefront of a lot of people's mind. Did you see a shift as far as the funding or the support that you were receiving, or that the VA as a whole was going toward as far as mental health?
If anything, I've seen more support for it. I mean, we have plastered everywhere. We have the suicide prevention hotline number. We have mental health. It's actually with the local VA. They're actually working now they're going to have a whole mental health facility just for the veterans.
Wow.
Outside of the hospital. So mental health is like really, really big. That's one of when I'm going out to see my veterans, that's at the top of my list. And they mandate us, like we have certain things that we have to check off every time we see them to make sure that mentally they're where they need to
Didn't they
be.
back here close a lot of mental facilities? Few
Not so
years
much
ago?
on the government. I think that
No,
was
I'm talking about,
so
I'm
just
talking about
as a whole.
yeah, as a whole. That,
Yeah. I think a lot what I've just seen is we need to focus on physical health. Physical health is very important, but I think a lot of times mental health kind of gets just thrown to the
Right.
wayside until something happens, because people just assume that there's only mental illness, but mental health is a continuum. You want to stay well, not just so. When we're looking at mental health, you don't want to just focus on mental disorders like PTSD and schizophrenia. You want to look at just average person, like how am I
Right.
doing mentally?
Right.
I mean, I say this all the time here lately. I said with COVID, everybody deserves a free seat on somebody's couch, because
Right.
it's been so mentally
Stressful.
draining.
yeah. You don't know if your kid got it.
Right.
your
Yeah.
significant
I
other got it.
also think that's true too, of dealing with like death in our everyday life. Like if my grandmama died, like you don't know how to deal with that because you didn't have a grandma die
Right.
before. So it should be some kind of,
Right.
mental consolation for
And
us
that's
that
a lot of
concern
what
also.
they talk about, like that we didn't get,
Right.
like for us our culture and,
Yeah.
Right.
and dealing with the mental state of people. You don't get to express, especially
Right.
men. Not saying anything about the ladies, but
Right.
especially men, you don't get the release.
Express yourself freely, right,
You know what I'm
'cause-
saying? Because you're supposed to be
Right.
macho and you're
Right.
supposed to be this, this big man, so you don't talk about it a
Right.
lot. But I think like us, I know all us, we talk a lot and we can talk to each other. Is that not a form of?
I don't think so, but
It is.
I'm just asking.
it is a
It
form,
is,
but
but
I don't know how effective.
I'm an advocate for mental health, like actual counselors, therapists.
Group counseling. Group counseling. That's what I went and got.
That's what you call us. That what we do. That's group counseling.
Huh?
You talking about professional counseling or group?
Nah. So when I went and got my master's in counseling, when we had to go, because you actually have to do the counseling.
Okay.
So, which I ain't gonna get none of the other stuff after this. I ain't got time for that. But when you did, the only one that I saw that was super effective to me was group counseling. And the reason why I say that is because you take somebody like me, I don't talk to strangers, right? And normally those people that come from our cultures are the people who need the counseling the most, because we ain't never talked to nobody.
I think sometimes, strangers can better assess your situation though.
Well, that's what I mean. When you in the group, it's strangers, because it's people you don't know, but it make you feel more open and comfortable when you hear somebody just as screwed up as you. You know what I'm saying? And so when you hear somebody that they got, because I'm sitting there, no lie, I'm sitting there in the counseling session, because we got to do it for class, and I'm sitting there like, man, these folks screwed up, you know what I'm saying? And I started thinking about myself. I'm like, well, shoot, you done had some of that stuff happen to you.
Right. So that's where we're at now. So we're just now at the point that we're beginning to admit the issues that we have in our community. Yep. Because there's a lot of fairy tales out there. You hear people say, well, African Americans, they've been through so much, they're just so strong, they're rugged. That's why you don't see us committing suicide. That's the reason why you don't see us doing all of this crazy. And that's not true. So right now here recently, the African American suicide rate is going up, just like everybody else's. And it's because we're not addressing the issue of mental health is so taboo that we don't want to discuss it, because that identifies you as weak because we built up that mentality that if you have an issue with mental health, you're a weak individual. And it's the same way with your veterans, whether it be the sympathy that they garner from their injuries. Because if I come back from overseas, you can see an individual that's missing his leg, and you can empathize with an individual that, wow, he really sacrificed a lot. He no longer has a limb. But you can't see what's in his head. You can't see what's going on, so you can't
I sympathize with you. I done been there with you.
But that's what I'm saying. That's what I'm saying.
I won't tell the whole story.
You tell the whole story. We'll edit it.
Man, so P come back, right? And him and Charles. Did you and Charles come back?
Charles came back before me.
All right, so I picked Charles up from the airport first. So, man, I've been around these dudes in college the whole time.
Right, so you know him.
So, yeah, I picked Charles up at nighttime, so we on the way back. Every time I flash the lights from bright to dim, that joker wake up. And I'm sitting there like, man, my joker waking up ain't saying nothing. Like, what's going on? Because you done heard the stories, but you don't really know.
Right.
So he get back with that. P come back a few months later. Man, I had to change my class schedule. P came and woke me up every day at 8 o'clock on the dot with a bottle of Parmesan and drove around. We drove around Troy every day. And I was like, I don't know how to talk to him about this.
Right, you can't relate to that.
Wow.
So here's what happens. When you get ready to deploy, you get a full screening, right? They're checking your hearing, they're checking your sight, everything. Maybe 3 months, train up time, medical that you're going through. You launch, you deploy. You come back and you're there for 3 weeks and they check off and you're good to go. Well, at that time, because all of us are scattered now, you don't realize that everybody is having the same problem. You don't even realize you have a problem.
Right.
You just realize until somebody points it out to you that, man, this is not normal. I thought it was, jet lag, there the pace was so quick and now everything is slow, so I just need something to do. So it took a while to realize that, I'm off right now.
P a big dude, and I'm still a little, but I was a little more. You know what I'm saying? He right around here with a ball of power every morning. I'm like, bro.
And so it wasn't until we all got back together, because you have a 90-day cool down period, and then that's when everybody gets back together, and that's when you realize, again, we're laughing about it, but at the same time, it helps because I said, okay, it's you two, so okay, if it's all of us collectively, we can get this fixed. Now, unfortunately, some people didn't, and you saw them roller coaster down from one thing to the next. Because if you don't, particularly those that don't have someone close to them that knew them before. So they can see them and they can say, well, the individual just changed, and not put the why with it.
Is that stressful on your job though, seeing that, like what he talking about, people, sometimes go down that road?
won't say stressful, but I carry that with me.
Right.
So when I go, when I go home, it's not like I'm clocking out and that's it.
Right.
Like I'm going home, my phone may ring, it may be somebody has something going on, a caregiver calling because so-and-so won't take their medicine and they walking up and down the street and the neighbors want to call the police, like those, and that's like real, like
Right.
has happened. So I won't say stressful, but I definitely see myself carrying that weight, like
Right.
constantly thinking about, okay, what could I do better? What can I do different? What do that type of
So
thing.
you being a medical, in the medical profession, what do you do for us? We talk about everybody else, but I mean, a lot of y'all see a lot of stuff, and y'all see people in really they bad places.
Yes.
So what do y'all do to
Right.
detox from all of that?
So I tried, when I first started out, I would never take time off. Now I can tell when it's time. Like a few weeks ago, I was like, okay, every time my phone rings, I'm getting a little irritable. I need some days off. I need to
Right.
put this phone up. I need to put this computer up. And I may not go anywhere. Like with COVID, I couldn't go anywhere. But it may be something simple as I've gotten one since I've done with school, I think. I like watching Netflix. I watch Netflix. Spend time, spend time with Malia, spend time with Joe. I like to do a lot of non-work reading.
Right.
So I like to read. And I love sitting outside. Just like
Okay.
sitting outside early in the morning. I love doing that.
Okay.
That's my kind of detox and relax. Cause mentally it can be a lot. Sometimes you go to bed thinking about these. Like I went to bed like thinking about somebody, knowing that say they actively dying. Just last week I had someone pass away. When I got off the phone with his daughter, that Tuesday before I took off my week, I was like, he's probably not gonna make it. And sure enough, my first day back, I thought about him the whole time I was off.
Wow, it's gotta be difficult.
I thought about him. He was like 100. He's like 101. I would always talk about him because I thought it was so impressive that he was like 101 and still lived by himself.
Right.
Cook Thanksgiving
Do
dinner for his
everything.
family. Like he just kind of he had a quick decline. And I was like,
Wow.
he's not gonna make it. So that within itself can be a lot at times.
Right.
It can. So I just have to know when, okay, I got to step away. I got to take a day off. Maybe today I don't need to open my computer when I get home.
Right.
Maybe I need to ask the doctor I work with to take my call.
My doctor that I go to, she always asks me that when I'm in the how's work, you sleeping? You know, I'm like, man, what does that got to do with anything? But you,
Yes, because mental health is such a big
Yeah.
part of physical health. I often say this: stress brings about sickness.
Right.
If you stressed out, your blood pressure going up, you might have a heart attack, you might have a stroke, you might have migraines. You're more likely to have illnesses like the flu, COVID. So stress brings about sickness. So that's whenever I go see my patients, how you sleeping? Having any nightmares? Those are
right.
all that plays a part. Because if somebody's not sleeping, if they just went to bed at 3 a.m. and they up at 8 when I get to their house and they irritable and their blood pressure 180 over 100. Okay,
Right.
what did you do? I hadn't slept.
So you can
So
understand
you want
why.
each one of them house. They're not coming to you. It's interesting.
Yeah.
Yeah.
That's by yourself. They gotta pay you a lot of money.
Right.
All right.
That's scary too.
Yeah, that's
But you know
scary.
what's
That's
so
scary.
amazing?
Wow.
Now, before I worked in the government, when I was a nurse, before I went back to Nurse Practitioner school, I did home health. I was a home health nurse. And I went to people's houses in my own car. Now, at least now I'm going, they don't know my tag. Now, back then, I had to
You
give
going
out
on a
my...
company vehicle now?
I'm in the government.
Yeah,
But
okay,
back
yeah.
then, I had to drive my own car and use my own cell phone number.
Yeah.
So that was a
that's
different kind of, but
crazy.
I've never, because Joey, he was a little, when I took this job, he remembered how it was when I did home health. He was like, now wait a minute now.
Right.
We're going out all time of night, because back then when I did home health, if somebody called at 11 o'clock at night and they IV won't go in, you got to get up and go.
Oh wow.
And you go into places that you might have just saw on the news where they found a body, but
Oh,
you got to
wow.
get up
You
and
gotta
go,
get up and go.
you know.
Right.
So, but I can say my patients, I've never felt fear. Like my patients have always taken care of me. When I went into, I never forget, I had a lady, she lived next door to a house where they took in some activities that were not exactly legal. And she knew it was all kind of people gonna be there. And I get out of my car, it's just me with my little bag. They don't know what's in my bag.
Right.
Right.
She would always tell me, she said, call me 5 minutes before you get here. And when you get here, do not get out of your car. My grandson will come get you. And every time she did that, and I never felt worried.